Hi, baddies. Welcome back to another episode of Terra's Baddies Club. I am your host, Terra Newell, and I'm so excited for today's episode. But before we get started, let me tell you a little bit about my week. I met someone amazing today. I did their podcast. Well, I met them the other day at a Spotify party, and I'm very excited that I got to do her podcast. It was something that I manifested, I wanted to do. And then yesterday I went to Disneyland, and then 5 days before that I was house sitting, and Disneyland was just a nice break from working so hard and working so many days straight. It was just the break that I needed. So I'm excited to get into today's episode. We have hospice nurse Penny Smith, and she also just came out with a book, Influencing Death. So, we're going to talk about her book and also talk about the end of days and dying, what it's like to go through that process. Also, tips like how do you know when someone's going to be in like near the end, and also how to take care of that person the end of days. We're going to hear a little bit about her experience with a few people's stories that really touched her and also really touched me today. So let's get into this episode with hospice nurse Penny. Welcome back to another episode of Terra's Baddies Club. I am so excited because I have Nurse Penny with me. She is hospice nurse Penny, and I am a huge fan of hers on TikTok, and I want to welcome you. So, welcome to Terra's Baddies Club.
Thank you. Thanks for having me. I'm honored to be considered a baddie.
Yes. Well, and I love the pink vibes. If you look behind me, it would be all pink sound, whatever they're called that stick on the wall. Sound.
Well, I didn't even know they made them in pink. Mine are all black. I'm going to have to reinvest in some pink ones.
Yes, but I love the pink vibe. And so, for those that don't know who you are, can you tell them a little bit about yourself?
Sure. I am a nationally certified hospice and palliative care nurse. I've been a hospice nurse for about 20 years, and I am a social media death influencer. So basically, I'm on all the socials talking about hospice and death and dying in various different ways. I do straight talk education, answering questions from people who comment, and I do a bit of dark humor by teaching through the use of TikTok trends and lip syncing and dancing around and pointing at words, and that's kind of what I'm known for. That's my niche, dark humor.
Yes, I feel like I found you because of morbid videos. And you were talking about, I can't remember exactly, but just like the body and decomposition and all of that great stuff. And I also was drawn because you were so connected with death, and I am connected with death as well in a different way.
Yeah, I love that you said that. You're the first person I have ever heard say connected with death besides myself, because I had death anxiety when I was younger, well, younger being in my 30s. And then I became a hospice nurse and I got over my death anxiety. And when I went out of the field and went into a hospice quality position, I started feeling that death anxiety coming back again. And that's what I said was, I don't feel connected to death anymore because I'm not at the bedside with people who are dying. And then getting back into social media and talking about it all the time and educating about it helped me again to reconnect with death. So yeah, I love that you phrased it that way, connected with death. I think that we're all connected with death. It's just that not everybody admits to it, right? Like,
Yes, yes. And I'm the person that if I have an older dog with me, someone's older dog, the dog might pass away with me. And it just, dogs and animals feel comfortable to pass with me.
so you're like an animal death guide.
I guess so, because like two of my sisters, they had dogs. I've watched them, and then they died with me. And I think that for one of them at least, I don't think that that death would have been very well handled. And so the dog felt a sense of peace. And these were all older dogs too. But it's just, I think that with death, there's an energy with it. Do you agree?
Mm-hmm. Absolutely. Yes, 100% for sure. So, and I'm going to be the interviewee turned interviewer because I'm curious to know from you, was this pre your experience with death, the big traumatic death experience that you had? Were you connected before that, or do you think it was through that experience that you became more connected and started being kind of a guide for these animals, if you will?
That is an interesting question. I think it happened more so afterwards, but there has been a few experiences where my Cavalier King Charles Spaniel passed away right before John attacked me. And then also I rescued this border collie from this pet shop that I used to work at, and I stopped working at it because I just wanted to be more ethically inclined with animals and
Mm-hmm.
not having them in cages and not selling them from puppy mills. I didn't quite agree with that. And so I rescued this dog. This dog had a heart murmur and was told to only live less than a year. And so I took it in knowing that the dog would die. And then that was my really first experience with death. And I stayed with the dog while it passed because I I cared about it so much, and I wanted him to know that, like, there was someone with him in this moment. Yes. Why did you get into being a hospice nurse? I feel like your energy, just meeting you now in person too, is I hate to say this, like someone I would want to be with if I were to pass, you know?
Thank you. Thank you very much for saying that. So I got into it's kind of layered why I got into hospice. So I didn't go to nursing school until I was 40 years old. I was very troubled in my younger years. I was into drugs. I was a drug addict. I went to jail several times. I gave my son to his dad to raise when he was 4. And it took me a long time to kind of get my act together. And I started to do that, turn my life around when I was in my late 20s. And when I decided to go to nursing school, I was going to nursing school because my second husband and I were getting divorced, and I had been a stay-at-home homeschooling mom, so I needed a career. And I wanted to do something that I considered service work. I felt like it was the time in my life where I wanted to make up for the transgressions of my youth and to try to really make something of myself. And so his stepmother had died on hospice about a year before. So I had this experience of being with these hospice nurses who cared for her, and I could just really sense that the work that they did was sacred. It was just something that really spoke to me. I also had, like I said earlier, extreme death anxiety. So I kind of had a morbid curiosity about death. I had never seen a dead person. I had never seen a person dying. She died at the hospice care center. I wasn't there as she went through her dying process, so I didn't witness any of that. And so there was several things that kind of drew me to doing it. But the main overarching theme for me was I wanted to have some kind of redemption for the crap that I did when I was younger, kind of make something of myself and give back to society after having really been, such a hindrance to the world earlier in my life. And so that's really what brought me to it. And it's something that, not everybody can do it. And I felt like if this is something that I can do, if I'm good at this, then this is where I need to be.
Yes. I love that. And I know that you talk a little bit about your addiction and I want to be careful or dependency in the book that you wrote as well. When does your book come out?
It's out. It came
Okay.
out on January 14. Yeah, it's been out for a while now.
Sweet. Okay. And then, so how has that really, like, what made you want to write about that part of your life and what led you to being a hospice nurse?
You asked the greatest questions, Tara. I love it. So when I got on a TikTok, I first started talking about death and dying. Well, not first. First, I was trying to learn how to shuffle dance, but didn't learn how to shuffle dance. Then I started talking about death and dying and realized that people were really wanting to know more about it. It was just at the height of COVID. People were dying everywhere, and so I kind of feel like, I'm trying to get people to engage in a conversation about something that's very taboo, right? It's scary, it's dark, people don't want to talk about it. And I'm wanting to educate because I've learned over the years of being a hospice nurse that normalizing death is the best way to make people less fearful about it. And being prepared for death is going to give you the best death. Like you'll have a better death if you're prepared for that in so many different ways. But to that end, I wanted people to believe me when I said there's nothing to fear. You don't have to be afraid. What I'm telling you is true. So I thought, this is what I do in my practice, in my hospice practice. I give a little bit of myself. I don't tell my patients I used to be addicted to cocaine, but like a little bit of this is who I am, right? Like
Yeah.
you can believe who I am. I'm authentically me. So I started doing that on my TikTok, and one of the things that I did was I shared that I had been sober for 8 years, way back when, and then started drinking again socially. And over the course of 20 or so years, my alcoholism started to rear its ugly head and it became more problematic. And that my husband and I had made a decision to quit drinking. So I basically told at that time, 100,000 followers, I've been sober for 3 months and I'm sharing this with you. I want you to know. And the response was overwhelmingly positive. People were really appreciating that about myself, that I was sharing that with them, and it inspired them. And I learned that my followers, they want to know more about my life. It inspires them that I went to school when I was 40 and just that I turned my life around. And so when I wrote the book, I wanted to include that in it. I wanted this to be not just, I didn't want it to be like this manual on hospice and death and dying, and I didn't want it just to be stories of my patients. I wanted it to really encompass everything that I've learned in life, everything that brought me to be a hospice nurse, enabled me to do the work with taking care of dying people, and how that impacted me, how that changed my life, how that helped my death anxiety. So that's kind of how I approached it. I just wanted it to be everything. And I started writing the book really when I was probably a couple years into my hospice nursing. So about 18 years ago, I actually started writing these stories down about my patients. And then just over the years kind of kept adding to it. And then everybody on TikTok kept saying, you should write a book, you should write a book. So I thought, all right, I'll do it.
I love that. I think that it's so unique to write your personal story and then also write about so many other people's stories as well.
Yeah, well, I mean, it's important. I mean, those stories are integral to my story. I always talk about life as a journey, and those people were part of my journey. They're with me still, not only them in the book, but so many more thousands of patients that I've cared for who were dying have all been a part of my journey and my story.
Yeah. Is there any one particular, I don't, would they be considered clients or um patients? Okay. Is there any one particular patient that has stood out to you or really changed being a hospice nurse to you?
Definitely, there's many that have stood out to me, and I've learned a lot from so many of them. But probably when anybody asks me what's the one that, see, I was just going to say there's one, and then another one popped into my head. There's one that is in my book who was 48 years old, and she had two daughters who were in their 20s, and she just really did not want to die. She had terminal agitation, and I spent a lot of time with that family and got really close with them. So she always sticks out in my mind. But one that really, really impacted me early on was a 20-year-old who came to the hospice care center. And I was a fairly new hospice nurse, maybe a couple, 2, 3 years working in hospice at that point. And she had a very rare retroperitoneal cancer, so in her gut. She had been in college and got sick, and the cancer was discovered. And when she came to the care center, she was in agony and she was just under the covers. Her bald head was starting to get dark stubble on it from, the chemo had been stopped, and she was just under the covers and just writhing in pain. And the other nurse and I were able to finally get her comfortable by putting an infusion on her and getting some meds going for her. And the next day, I walked into her room and she was sitting up in the bed and she had a little scarf on her head and she just looked beautiful. She was glowing in all of her 20-year youth. And she was on the phone. She had a cell phone and she was talking on the cell phone and she said to her friend, "Yeah, the chemo was just making me so sick. I didn't want to do it anymore." And I was just so moved by her bravery at 20 years old to say, "I'm stopping this treatment. I'm not going to go through this anymore." And she chose hospice. And she actually lived for about another 3 months. She was at the hospice care center. She turned 21 while she was there. She had a huge family. And I'll never forget, on her birthday, her dad, we had this player piano out in the lobby that played by itself. You could either, a person could play it or you could turn it on and it would play music. And she was out there in the lobby with their dad, and she had her IV pole, and she was standing on her dad's feet, and he was dancing her around the room. And it was just so beautiful. It was just an amazing, beautiful thing that I knew that she would have had that experience had she continued on the path that she was on. Her cancer was not responding to the treatment, and it was making her violently ill. So the quality of her life at the end of her life, it just really, it really confirmed to me that that is what hospice gives to people, is the best quality of life at the end of life.
That is a beautiful thing. And I'm so thankful that you do that. And I'm like, that made me a little bit emotional. That's so beautiful. Like gathering my thoughts now. But that's just so amazing. I think that it's very hard to see people in the end of their days and you make it so bright and happy. And at least like just in that story that you told me, with like seeing that moment and looking at the positive, do you think that you are a positive person to begin with?
Yeah, I think so. I'm a superstitious, so sometimes I don't allow myself to be positive about things because I'm afraid if I am, then it's not going to turn out the way that I want it to be. But I think overall, I'm pretty positive. I'm a happy person for the most part, and I'm positive. I'm definitely death positive, and I've seen so many people die that I can say with confidence that, people who get to a place of acceptance at the end of their life will have the best death, and that death can be beautiful. And I've seen beautiful deaths. And it's really a good way to look at the end of someone's life because it's not going to happen to all of us. We can't avoid it. Nobody gets out of dying. And to be able to embrace it and take that experience with your person who's dying and make it into a beautiful memory will last forever with you as long as you live. My dad's death was sad. Death is always going to be sad, but it was also beautiful. We got him his favorite meal at the end of his life, and we all spent time telling him what he meant to us. And then when he died, we all grieved together as a family, and it was beautiful. It was life, it was laughing, it was crying, it was just holding on to one another for support. And it was a very beautiful experience. And we had that because we were able to say, "He's dying. This is it." And that's when people can really have the best closure. That's the best end, is to be able to acknowledge they're dying, and let's talk about it. And what do you want to do? Let's be with you now, because we can say for sure that you're dying and this might be the last time we're together. And so let's make the best of it, rather than let's not talk about it. And then people don't get to say what they needed to say to their person before they died. They miss that opportunity.
Yeah. Do you think it's easier to cope when you have that acceptance, especially for the families?
I think it is easier to cope, but people will often ask me, is it not as sad because you work? It was, of course, very sad when my dad died. I loved my dad and he died too young. He was only 69. I'm 63 this year, so 6 years older in 6 years from now, that's how old my dad was when he died. So, it was very, very sad, but we were very much able to cope with the grief better. We were better equipped to cope with the grief because we were accepting that that's what was happening and we felt, and we had no regrets. We didn't have any regrets or guilt over how things went at the end for him. We did all the things that we wanted to do. We didn't do everything because we wanted to take him back home and I wanted to be his hospice nurse, but that didn't work out, but he died. He was literally on hospice for less than 12 hours. I battled with the doctors a lot at the hospital to try to be straight with me, and they weren't. They kept thinking they were going to fix him. And so we were going to take him home the next day. We had hospice come in the evening to sign him up. And at that point, we were able to go get him something that he wanted to eat because he'd been on a restricted diet in the hospital and spend our time with him. So ideally, we would have taken him back home and had more time with him. But we also recognized that my dad was just like so ready to be out of here. He was just like, I'm out. He told the nurse, I'm about ready to hang it up. And then he died. That doesn't happen very often. People don't die like that usually. It's usually they go through, if you're dying a natural death, you go through a lingering process, which can be hours, days, sometimes a week. I've even seen people go for a couple weeks where they're getting like more and more unresponsive, and then there's all these different signs, and then they slip away. Like people don't just have their last words and then close their eyes and die. That happens in TV and the movies. Rarely in real life does that happen. But for him, it did.
So I'm laughing, but I don't think I should laugh about this, but it's just crazy. Do you think some people are more spiritually connected?
Oh, yeah, for sure. So, this is what I've heard said, and I love this saying. There are two sides to dying. There's a physical side and the spiritual or emotional side, and both have to meet before death can occur. So I've seen people who were physically ready to go and spiritually they were not ready. And so they lingered and lingered. And then I've seen people who were spiritually like, get me out of here, and physically they weren't ready to go. And so they didn't go. But there are people who I think when they're physically ready and they get to that point of being spiritually ready, then yes, it's easier for them to go. And I think that was my dad too. He was just like he was ready.
Yeah.
He's like, I had a good life. It's good. I'm done. And patients that I've had that have said that usually don't live very long. But then I've seen people who weren't ready and they just linger and linger and linger and yeah. But I really know of very few people in my whole hospice career who died like my dad, who said, it's time, I'm gonna go, and then closed their eyes and died. They usually kind of, like I said, slip away. They slip into this unresponsive state and then they kind of finally slip away.
Okay. So when John died, like when he was taken off and everything, my mom literally said, "It's okay to go now." And then that's when he passed.
Yeah, that's something that it's kind of interesting. My thoughts on that have evolved. So when I first started in hospice, it was always all about tell them it's okay, tell them it's okay. And that's important for sure. And then I started working with patients where I felt like it's not okay. It's never okay to say, goodbye to someone. Like, it's not okay that you're dying. I don't want this to happen. And so I would say to people, tell them you'll be okay. You will be okay. Just tell them you'll be okay. And then I was talking to a social worker who said, if you're not really being authentic about it, then that's not going to ring true. What people really want to know is that their life had meaning and purpose. So that's what I always encourage people to say is tell them what they meant to you. Tell them that their life had meaning and purpose. I think the situation with John was a little bit different.
I'm like, I don't know if he had meaning and purpose in
I
his
think
life.
your mom really meant it's okay. Like you're out, buddy. Tried to kill my daughter, and like you can just move along now. It's okay. But definitely, I mean, that's a different situation because he was on life support, yeah, and then they took him
Right.
off life support, yeah. So somebody on life support isn't going to live very long,
Okay.
usually once you discontinue life support.
Yeah, well, he was brain dead, but they revived him at the scene. And I told someone, I was like, no, don't give him CPR. Like, he tried to kill me. And not like this manner at all. I was like more hysterical, but I was like, okay, they're going to do what they're going to do. And at the end of the day, okay, there's steps that you have to go through. And I'm like, it was just like a waste of medical resources in my.
Oh yeah, yeah. Yeah, see that's where talking about death and dying comes in. Again, that's a different situation, but advanced planning, like what do you want done for you if you're in that situation where your brain is dead? I have it's called Five Wishes. It's a great form where you can fill it out and it talks about these things on there like if you are found to be, there's no hope for life, what do you want done? And I've got that filled out. Do I want to be tube fed? Nope. Do I want to be on a vent? Nope. I don't want any of that crap. If I'm brain dead, let me go. And I
Yeah.
agree with you. It's a colossal waste of resources. But without that legal document in place, then the hospital is going to err on the side of life always. They don't want somebody coming along and going, we're going to sue you now because you let this guy die. Same with the CPR. They're going to do CPR unless somebody has something on their person that says don't do CPR, like a written directive, and somebody else can say stop, they're going to do CPR. It's actually one of the things that we help people take care of when they're on hospice is in Washington, it's called a physician order for life sustaining treatment. And that's what it's called in a lot of other states too. But basically, it's an order signed by a doctor that a patient says, I don't want CPR. I don't want to be on a vent. And then we tell our patients, like, if you're going to go somewhere, you need to make sure that you take this with you and that the person with you knows that you have it. Because if you are out on the street and you die, then you're going to get CPR. And it's not, CPR is horrible. I mean, you saw it, so you know how violent it is. It breaks people's ribs. It's, in a hospice patient, there's like less than 1% chance they can be revived. In a normal person, I think it's less than 15%. So
Okay. Have you had to do CPR on someone?
thankfully, no.
Okay.
So we do allow people to be full code if they come on hospice. We allow people to have choice, but I've always been really good about being straight with them about what this means, what's going to happen. And I had one patient who I talked about in my book who wanted to be a full code, and pretty much a couple days before his death, I convinced him not to be. He was so fragile, and I was really blunt with him. I said, they're going to come in here, they're going to pull you off the bed onto the floor because you have to be on a hard surface for CPR. And then they're going to proceed to fracture all the ribs in your skeletal body and rupture all the tumors that are poking out of your belly. And you're probably not going to survive that. But if you do, you're not going to feel better after that. You're going to feel worse. So I've always been good at convincing people not to. So I've never had to do it, thankfully. And when I worked in the ER, which was a very short stint, I never had to do it. But I've seen it and it's awful.
Okay. Well, I just like, do you even like after you get that done and you're okay, like you have to recover and from that still.
Oh yeah, yeah. You'll have fractured ribs.
Yeah.
Most if it's effective. I mean, they got to compress like 2 inches into your chest for it to be effective. So we had a patient that came to the care center who was a do not resuscitate patient, but wherever he was, when he went down, nobody knew that. So they did CPR and they were able to resuscitate him. And he came to the care center and he was so mad. He was like, he goes, I am in so much pain. He had to be on a morphine infusion because he had fractured ribs. He goes, why did they do that to me? He was furious that that happened. Yeah, it's not, it's, it's CPR is good for in certain circumstances. It's good for car accident victims or drowning victims in some situations, not if they've been down for too long, because then you are dealing with somebody who's brain dead.
Like over 6 minutes, right?
I don't know the exact amount of time, and I think it varies depending on like the temperature of the water. If
Okay.
the water is colder, you can live longer, like you have a better chance.
Okay.
But when I was doing clinicals I was working we have these houses over here in Washington called Ashley House, and there's like three or four of them, and they're for pediatric patients who are chronically ill or terminally ill. And I was doing a clinical in there when I was in nursing school. And there was a boy who was, I think he was about 17 years old. And when he had been 12, he drowned. And they were able to resuscitate him, but he was in a persistent vegetative state. He was tube fed. He wasn't on a vent, but he was tube fed. And he was just basically, I don't like the term vegetable, but it is a persistent vegetative state. That's what that means. And one of the nurses that worked there told me that when the firemen who rescued him came and saw him there, he said if he would have known that would have been the outcome, he wouldn't have started CPR
Wow.
because
Well,
it
because
brought him
yeah,
back to life, but it wasn't living. It wasn't really life.
yeah. Well, you see shows like Grey's Anatomy and all these other shows that they do CPR, the person's magically fine. They're like, and that's
Yeah.
not real case scenario.
No, not at all. TV and the movies, I'm telling you, they definitely do an injustice to death and dying. I was just watching a show yesterday, and it's a great show on PBS, but they show this old lady in her bed, her hands are like this, and she's got her eyes closed and color's perfect. She looks great. She's supposed to be dead. And I'm like, I always say to my husband, that's not what dead people look like. Drives him a little crazy.
That's great. Is there any signs that people kind of give you when they're about to go, or is it just different for everyone?
Well, it's kind of different for I mean, there are signs. There are definitely signs. So as people are really getting into the final hours of life, they really aren't responsive anymore. You can't wake them up. If you get anything out of them, there's no meaning or purpose. Eyes are almost always open or partially open.
Okay.
Not always, but almost always. Eyes are open or partially open. The jaws open, like hanging open. So they're like this. Sometimes the neck will be hyperextended, like they're looking up. Before they get into that unresponsive stage, they might be reaching up like this. They reach up into the air. They might be, picking at their clothes and stuff like that before they go into that unresponsive state. People will often get a death rattle, which is a gurgling noise, and it's because they're not swallowing anymore. And so, like, we all swallow our spit down and we don't even know we're doing it, and it builds up in the airway. And so when they breathe, it gurgles, it makes a noise. Patients' families hate that. I mean, it sounds really bad. They're worried their person's going to drown in the secretions. They're not going to, but it sounds really bad. That's highly predictive of death. When somebody develops a death rattle, most people will die within 48 hours of that happening. We also see things like color changes to the hands and feet as circulation changes. And so we can see like purple marbled appearing skin on the legs or the feet and really icy cold extremities because the dying process is a process. That's a Department of Redundancy department,
Okay.
but people's bodies are shutting down. So it starts earlier on with they're not eating as much and they're sleeping a lot. They're withdrawing into themselves too. That's like earlier on. And then they go through these stages. And so weeks before death, they might be talking about seeing deceased loved ones and pets. Very, very common for people to do that. Happens all the time. And then they also can use travel language where they'll say, I need to go on a trip. I need to go home. I need to get out of here. And really they mean they're getting ready to die. Sometimes they'll even say, I'm getting ready to die. They can be really confused. And when they're awake, it seems like they're not quite here. They're like here and then they're not here. So there's kind of this little back and forth thing. It almost seems like people will say like the veil is getting thinner. I love that terminology. And it doesn't matter what your faith is, by the way. It doesn't matter what you believe. It doesn't matter if you practice religion or not. People have deathbed visions without any, like, it doesn't matter what faith they are. They'll still see their deceased loved ones and pets. It just happens all the time. And then, like I said, the reaching into the air, which I have come to believe is reaching for those visions, because often those visions are up above them or to the corner of the room. They look in the corner of the room a lot. But then, like, back to the getting close to the end. So when people are really close to the end, they start breathing like a fish out of water. So they're kind of gasping and not really moving a lot of air. And what I've noticed is that people will start to thrust their tongue forward. Not always, but when they do that, then I know it's like really close. Like they're very close when they start to do that.
Okay.
So, we in hospice, we make educated guesses about when we think someone's going to die. We do it in time frames, months to weeks, weeks to months, days to weeks, hours to days, minutes to hours. Sometimes we're right, and sometimes we're not even close. It's a crapshoot. But there's been times when I was able to say, right now, come here right now, because it's happening. And it's usually been when I've noticed that tongue thrusting forward in the mouth.
Oh, wow. This is so interesting to me. It's just if I have a loved one near death, I would want to know. And it's kind of funny just because my grandma was saying such interesting things right before she passed. And she was telling us how she was having conversation with Doris and stuff and all her friends that she would do weekly lunches with. And we were like, oh, well, I told my sister, I was like, she's in between realms right now. And I was also telling my sister, I was like, she's close to death. And I don't know why I was okay with it, but when she died, of course I get sad and I miss her and have to mourn and process that. But I knew she was near. And then she also, I don't know if this was true or not, but my grandma was such a good, and like when I say good, just like followed all the rules, Christian, like was very conservative, like all of that. And then she was talking about having threesomes with men. That do patients just make stuff up as well? Have you experienced that, or do they just come out
Well,
with
I
a
don't
bunch
know.
of
Maybe she wasn't making it up. Maybe she had a wild time in her youth. I don't know. It's hard to know if they're making it up or not.
kids?
But people do, they do, like you said, it's like they're in another realm, and they often, I think they are. I think they are. Oh, there's one more thing I want to tell you too about the dying process that's interesting. So people like they'll have their eyes partially open or open, and they start to get this stare like they're not focused on anything. Like the lights are on, but nobody's home. And that is a really weird thing. And sometimes we call that the God stare or looking at heaven because they're just not in there anymore. And this nun told me one time, and this is actually the story that made me go viral on TikTok. And when I really started kind of thinking, oh, I should be doing this on TikTok, this nun told me that her body was still here doing the work of dying, but her soul had left. And you could see that in her eyes. And so I went into the room and I looked and I was like, oh my God, she's totally right. Like there's nobody left inside anymore. They're just not in there anymore. But so talking about the different realms, I had another patient, and I wish I would have wrote this one in my book because it's so good. And I at the time was writing the book and just forgot about this story. But I met this woman on a Saturday. She was admitted to hospice on Friday. She had been in the hospital and she went home to her daughter's house and her daughter was taking care of her, and I could tell she's like transitioning, which means she's going to be like she's more dying than she is living. That's what transitioning is, right? I know she's going to die pretty soon, probably within the next week or so. And so I'm like crash coursing the daughter on how to take care of her. Like this is how you give the morphine. Let's change her, put a Foley catheter in her, let's get her in a hospital gown, got her all set up. Came back on Sunday, made sure everything's going good. Yep, everything's great. She died on Monday, and the daughter called me and she said, I got to tell you what happened. She said that her mom was talking about windows that she could see in front of her. She was holding her hands up in front of her and talking about these windows where she could see events from her life in these windows. And then she held up her hands and she said, am I going to need these anymore? And her daughter said, well, I don't know. And then she started motioning towards her chest and she said, am I going to need this anymore? And her daughter said, your gown? And she said, no, no, this. And she was motioning towards her skin. And her daughter was like, I don't think you are. And then she died. I was like, whoa. That was the most, like, that was probably one of the most profound things that has ever, like, that I've ever heard. It was just amazing because of the whole like windows and stuff. So like, when you talk
Yeah.
about the realms, that's what I think too. I think people are doing life review. And so what I always say is When somebody's dying, they get into this unresponsive state and then they linger sometimes. And sometimes I've seen people that were lingering in that unresponsive state for weeks. And the family's like, what is going on? Why are they still lingering? Why are they suffering? And I will always say they're not suffering just because they're lingering. If they're comfortable, if their face is relaxed, then we're not worried about it. They are comfortable, they're not suffering. The family's suffering because they're like, when is this going to happen? When will this be over? It's anticipatory grief and it makes you feel guilty because you're like wishing for your person to die. So that's normal for them to feel that way. I always think we don't know what's going on in somebody's mind when they're dying. We have no idea what they're thinking about. And maybe they are doing life review. Maybe they are processing all the things in their life. Or maybe they're liking hanging out, reliving these experiences. The older I get, sometimes I start I start thinking about, oh, I wish I could be back in Okinawa again when my girls were young and I was breastfeeding my daughter, my baby daughter, and my son was there and my older daughter. And it was such a, it was just like, it's kind of like, oh, I wish I could relive those times again. And
Yeah.
I think if I'm dying and I get to relive those experiences, then I'm going to want to sit with those for a while,
Yeah.
And that's what I think about lingering. I'm okay with it.
Do you have any thoughts about death now since did you always like have the same thoughts about death since you got into this industry?
No, not at all.
Okay.
I wasn't raised with any religion, so I had no concept of afterlife. I still don't believe in heaven or hell, but I do believe in an afterlife because of working in hospice, because of seeing people deathbed visioning. I do believe that now. And my dad came to me after he died. And like I said, I had death anxiety. I was terribly afraid of dying. I didn't want to think about it. It was crippling. I would cry about it at night. I couldn't sleep. It worried me so much. And I don't anymore. I feel like I just accept that it's going to happen and I can just go on living my life and not worrying about it. I have no control over it. None of us do. We really don't. So it definitely has really changed me working in hospice in many, many ways.
Okay. Well, I just think that if I started working in that field and I had like this view, then I would completely change it just having these experiences?
You might, yeah. It depends on, well, I think it depends on you as a person. Are you open to learning more, experiencing more, Um, I think definitely it could. I know lots of people who have gone into hospice and thought one way and then came out of it thinking another way.
Yeah. Do you guys create like a little group or a support group or anything? Because I know that it can't be easy always going through this.
Well, I mean, we have our team. So hospice care is a different kind of healthcare program because we have an interdisciplinary team, which means that we have a nurse, we have a social worker, we have a spiritual care advisor. They're also called chaplains. We have a hospice aide, we have a doctor. And so, you know, we have each other to lean on for support. But also, most people who work in hospice, myself included, don't feel like it is really emotionally draining. Sometimes it can be a little bit raw when you see somebody young dying, that's hard not to feel, sad about that or have that kind of drain you a little bit. But we know that our patients are going to die. That's that's all there is to it. We're not causing their death. They're just dying because everybody dies. And if we've done our job and we have helped them to be comfortable and given them a better quality of life at the end of life. We've prepared the family so that they're not afraid of what's unfolding and they get to have a beautiful end of life journey with their loved one. When they die, it's a job well done. It is the expected outcome.
That's so great. I think I've talked to someone who may probably may not have been fit for this field, but every time a person would pass, they would kind of get depressed and mourn that death as if it was their own.
Yeah, that's a problem. That's somebody that doesn't have good emotional boundaries. So you have to have professional boundaries when you're a nurse in any nursing role that you take on. You have to have professional boundaries, but in hospice especially, you have to have good emotional boundaries. You have to remind yourself, this is not my family. This is not my person. This is my job. I'm here for this much of their life. I can't get embroiled in family drama because all that was going on before I ever got here. You really have to be able to separate yourself from that. I remember when I was first putting videos on TikTok and somebody said, I don't remember what the video was about, but somebody commented and said, the nurse was crying more than I was, and it made me feel very uncomfortable. And so I was like, it's you can't do that because people grieve differently, and sometimes people grieve without crying. And so can you imagine how awkward that is? Like your mom just died and the nurse is bawling their eyes out and you're kind of like, like, what do I do now? I don't cry. It's not making me cry. I'm sad, but I expected it. You know what I mean? It's like you really have to have good emotional boundaries. And if you don't, you're not cut out for the work. And that's okay. I mean, not everybody can do it.
Yeah.
They might be better in a different nursing role. I worked with a nurse like that who cried all the time. She absolutely could not stand it. Like it was so draining on her. And she finally quit. And I was like, good for you. You got to do what's right for you. And I saw her a year later and she looked fantastic. I bumped into her at the hospital. She was working in a dialysis unit and she was so happy. She said, I love it. It's the best job ever. And I was
Good.
like, that's great.
Good.
No hate for anybody who can't do the job. Some people just they have this heart that brings them to it. They're like, we really want to be able to do this. I have the heart for this. I'm so compassionate and I really want to do this. But then they can't separate themselves from the fact that it really is a job. And that's not to say that I'm not compassionate and I'm not cold-hearted. I'm definitely a very compassionate person, but I know my role, and I think probably how I lived my life earlier prepared me for being a hospice nurse. Like, we aren't shrinking violets. We are hardcore, especially home hospice nurses, which I did for several years too. MacGyver nurses. Like, we are out in somebody's house who might be a hoarder. You're tripping over boxes, you're shoving cats off the bed while you're trying to do a sterile procedure, and then you're having to figure out how to deal with a wound that you never saw in your whole nursing career and nobody ever taught you this could even happen to the human body, and you're trying to figure out what to do. I had this one patient that I was talking about that was the full code patient. He had these tumors popping out of his belly that were leaking stool everywhere. And we were having to try to figure out like how to put ostomy appliances on him here and there and everywhere with bags to catch stuff. We had another guy at the hospice care center that I don't remember the procedure that he had. He had some kind of gastric cancer, like stomach cancer. And so he had a tube put into his bowel at some point in his bowel. And when he would eat, the stuff would go into this tube and into this Foley bag that we had hanging on the bottom of the bed. But this guy didn't want to eat any kind of liquid diet or pureed diet. He would eat like cheeseburgers and it would explode the bag and crap would go everywhere and we'd have to clean it up and figure out a new way to, contain this stuff. So, all that to say, it's tough. It's tough. You have to be tough, not just emotionally strong, but just tough in general to deal with these things.
Well, so many people would get grossed out by that, and you have to make them feel comfortable. You have to act like it's normal, and it is normal for the human body when they have that going on.
Absolutely. Yeah, we call it the nurse's face. And yeah, you have to be the master of the nurse's face. You don't want somebody to think that they're disgusting, because they're not. It's not their fault. They might have disgusting wounds, but that's not their fault. Their body has turned against them. So the last thing you want to do is make them feel, inferior. It's you want them to feel dignified, That's a lot of hospice is about helping give people dignity at the end of their life. And so you do have to be able to deal with things like that. Just like, yeah, no big deal. I'm just going to clean this up and I'm going to just put a new appliance on. We're going to figure out how to do this. It's all going to be good.
Yeah. Yeah. Well, I am so thankful for you. I feel like I could talk to you about death all day long. But is there anything I didn't ask that you want me to ask?
No, I think we covered a lot.
Okay. Perfect. Well, I'm going to ask you a few questions for the Patreon, but for the people that are jumping off here, where can we find your book? Where can we find you on social media?
So I have a website, hospicenursepenny.com, and there's links to buy my book there, but also it's available on Amazon, Barnes and Noble, Tertulia, anywhere you can buy books online. It's available in audiobook as well, and I narrated it. So that's on Audible or audiobooks. I am Hospice Nurse Penny on TikTok, YouTube, Facebook, and Instagram.
Okay, beautiful. Well, thank you so much, and I'll ask you a few questions for the Patreon. Thank you for listening to today's episode with Hospice Nurse Penny. Please check out her book, Influencing Death. If you also like this episode, please give us 5 stars, a comment. If you're on YouTube, just comment below. I love to hear your feedback. Give a like button, subscribe. But until next time, I'm Terra Newell, and thank you for listening to Terra's Baddies Club.